Okay, welcome back to part 3 of the nutrition support presentation for Skills Lab. So at the end of session 2 we made our way all the way to discussing how to calculate a TPN formula, and there's a few steps that you can follow that I'm going to go over in just a minute. And again, this is sort of like a race. It doesn't matter what path you take, as long as everybody gets to the same finish line in the end, it's good enough. Again, you can get 10 experts in a room and you'll have 10 different ways of coming up with TPN formula, but in the end the amounts and grams and things should all be kind of in the same ballpark. It's not an exact science. As long as you're in the ballpark, that's what matters. So let's go through this example or this slide here of the steps it takes. So when you want to come up with a TPN formula, there's a few things you need to consider. First of those is how many total kilocalories per day should this TPN bag or formula or solution be providing? So first thing you want to do is calculate the total kilocalories per day. And you'll remember a few slides back, we had some recommendations for total kcals per kilogram per day. So weight-based dosing and based on various medical conditions. So then the next step would be to calculate the protein dose, and then we'll convert that to kilocalories. Again, going back a few slides, in addition to the total kcals per kilogram per day, you can see various ranges for total daily protein dose per kilogram. Weight-based dosing is provided. So far, numbers 1 and 2 should be fairly straightforward, calculating total calories and protein dose. Then convert the protein dose. We divide that by 4, constant of 4 for 4 kcals per gram of protein. Then number 3, we determine the fat dose, and then we can convert that to kilocalories. So how do you come up with the fat dose? Well, one way would be kind of use this guideline, and generally anywhere from 10 to 30% of your total kilocalories provided as fat will provide adequate fat macronutrient to the patient. So after we do that, we're going to want to determine our carbohydrate kilocalories, and we do that by subtracting the protein and the fat from the total kilocalories. And here's the equation. Total kilocalories, which are determined in number 1, the protein kilocalories, which are determined in number 2, minus the fat kilocalories. And that'll give us our total carbohydrate kilocalories, because the total calories is carbohydrates plus fat plus protein kilocalories. So once we have our carbohydrate kilocalories, we want to convert that to grams. Remember, we're trying to go back and forth with calories and grams to ultimately come to this prescription here to come up with grams per 100 cc's of solution for dextrose, amino acid, and lipids. So after we have all of our calorie and gram amounts, then we need to determine that volume of the TPN bag. Again, if we write it in pharmaceutical percentage, the weight per volume, we'll need to know what the total volume is in order to come up with a concentration. And again, our percentage, pharmaceutical percentages, tell us the amount of grams for every 100 milliliters of solution. Okay, so let's walk through an example of these 7 steps and how we come up with a TPN prescription that the pharmacy can prepare and dispense. So in this case, we've got a 49-year-old white female, status post bone marrow transplant. She currently has 0 PO intake due to nausea, vomiting, mucositis, and all these problems are very typical of somebody who's undergone a bone marrow transplant where the high-dose chemotherapy has wiped out not only the bone marrow but a lot of their GI tract cells and taking its toll on some other things. So kind of fairly average size, 5'7", 66 kilograms. Her ideal body weight's 62 kilograms. So in I think the last session we talked about what's the weight you use for these weight-based dosing equations. And if the patient is between 100 and 125% of their ideal body weight, then you would want to use their actual weight. And so you divide 66 by 62 and it comes up with about, I think this patient ended up being about 106 or 107% ideal body weight. So we would use the actual weight, 66 kilograms, for nutritional dosing purposes. If she was greater than 125% ideal body weight, we would use that adjusted body weight equation that I showed you a few slides back. So first thing, again, number one, calculate total kilocalories. So from the slides back here, bone marrow transplant, 30 to 35 kcals per kilogram per day, and the protein dose, 1.5 to 2 grams of protein per kilogram per day. So 30 to 35 total kcals per kilogram per day. So I just picked a middle of the road number, 32. 30 would have been okay, 35 would have been okay as well. So multiply by her weight, 66 kilograms. Come up simple enough, 2,112 kilocalories per day is what we estimate she's burning. So that's the amount of kilocalories we'll want to give her each day to keep her in a nice neutral balance of kcal ins and outs. So again, number two is calculate the protein dose. So from the guidelines a few slides back, 1.5 to 2 grams of protein per kilogram per day. I stuck with the low end of the range there. 1.5, 2 would have been fine as well. Multiply her by her weight of 66, you get 99 grams. 99 times 4 kcals per every gram of protein gives us 396 kilocalories per day that she'll need. So step number 3, we want to calculate the kilocalories and the amount of fat that we need to provide. So at the medical center, it's pretty easy. We either use a 100 ml bottle or bag of intravenous fat emulsion or a 250 ml bottle of fat emulsion per day, and it's a 20% concentration. So I know that provides 2 kcals per every ml. So a 250 ml bottle, which is what we use for most adults, provides 500 kilocalories per day. The 100 ml bag obviously provides 200 kilocalories, and that's what we use for smaller people, usually people less than 60 kilograms of body weight. Okay, so now we've got all the kcals from the we've got the total kcals from protein, kcals from fat. Now we need to figure out kcals from carbohydrate. So again, that formula was total calories minus protein calories minus fat calories. Gives us 1,216 calories from carbohydrate. And we know that there are a gram of carbohydrate gives us 3.4 kilocalories. So in this case, we're going to divide 1,216 calories by 3.4 kilocalories per gram, and we get 358 grams of carbohydrate. And then we need to calculate a TPN volume, and typically you can go with a rule of thumb of 1 milliliter of fluid or TPN volume for every kilocalorie that you're going to be providing in that TPN bag. So our patient was 2,100 calories, so 2,100 ml bag would have been adequate. I know that this formula will fit in an 1,800 ml bag. It's just kind of a convenient and familiar number that translates to 75 mils per hour to the nurse, and that's what she'll program into the infusion pump. So I picked that. I could have chosen anything from about 1,500 up to 2,500 milliliters per day, or size bag of TPN. Those would have been okay. So again, we want to write our prescription in final concentrations, or gram per 100 milliliters, or percentage. So we need a percent dextrose, percent amino acids, and a percent lipids if you're using a 3-in-1 system or total nutrient admixture. In this case, our lipids are a separate piggyback infusion, so that won't actually be part of our prescription. So from the 2 slides ago, we determined we're going to need 358 grams of dextrose. That's going to go in an 1,800 ml TPN bag, but we want it in terms of this percent. So 358 grams per 1,800 mils equals how many grams per 100 mLs? And the answer is 19.9. So we call that 19.9% dextrose. Same thing for the amino acids or protein. It's 99 grams per 1,800 mils. That translates to 5.5 grams per 100 cc's, or 5.5% amino acids. And here's the final prescription that we can send to the pharmacy, and they'll know what this means and be able to convert all this into an actual TPN bag that we can send up to the patient's room. The nurse will then infuse it through the pump. So our final prescription, I just rounded from 19.9 to 20%, but D20% amino acid 5.5 at 75 mils per hour, plus the lipids, in this case IV lipids 20%, 250 mils per day at 21 mils per hour. And we infuse the lipids slowly over about 12 hours. So when you're choosing things like the TPN volume, like I said, 1 milliliter for every kcal is a pretty good rule of thumb. But there are a few kind of ranges you can be thinking of when it comes to you calculated your numbers, whether your grams or your final concentrations in percent. And if you kind of keep these ranges in mind, you'll know if you're basically within the range or off. So if you get something that's lower or higher, you may want to recalculate, double check your math, or ask somebody to kind of take a look over your shoulder at what you've come up with. So here you can see for the dextrose, the range in grams, the final concentrations. Same thing for amino acids and lipids. In this case, the 10 to 30% is the final percentage of total calories you should be providing as lipid to the patient. It ends up being about 20 to 50 grams a day. And in a 3-in-1 or TNA type of TPN, where the dextrose, amino acids, and lipids are all in the same bag, your final concentration of lipids should be between 1 to 3%. And again, that should equate to 20 to 50 grams a day. And your TPN volumes are typically 1.5 to 2.5 milliliters per day. We can go as high as 3 liters. I think that's the largest bag size that we carry. That's a pretty big patient getting a lot of calories. Just a few notes about the lipids or fats. We have a lot of different synonyms that we use interchangeably for this product, but we call them lipids, fats, esterified triglycerides, emulsified triglycerides, intravenous fat emulsion, intralipid, lipocin. Those two latter ones are actually brand names of the product, and you can see in the picture what the product looked like. I need to update this picture because now it comes in a plastic piggyback like most other solutions that we infuse intravenously. But the total dose, again, like I mentioned earlier, should be between 10 to 30% of the patient's total calories. And serum triglyceride kind of plays a role in how we decide that dose, whether high end or going up to the, going down to the low end of 10%, because these are esterified or emulsified triglycerides. That's the source of the fat that's being provided. If a patient's serum triglyceride is elevated, then it may not be a good idea to provide a whole lot of intravenous triglyceride on top of that. It can lead to certain problems like pancreatitis is probably the most worrisome of those. And again, the infusion rate, like I mentioned in the last slide, we like to infuse it slowly over at least 8 to 12 hours, preferably over 24 if you have a 3-in-1 TPN admixture, TNA. But infused too fast, it can clog up the reticular endothelial system, which are your body's macrophages, monocytes. So too fast of an infusion rate could lead to immunocompromise. And these are just a list of the ingredients of electrolytes that we put in TPN. Of course, they have to come in a salt form. You can't just add straight sodium cations. It's impossible. It always comes as a neutral salt. So sodium chloride or sodium acetate or sodium phosphate are our 3 sources of sodium. So on and so forth with potassium. And calcium gluconate and mag sulfate are also commonly added. And the ranges that I have over here listed are basically the mins and maxes of what we can put in a TPN. These are not the recommended ranges for dosing. That's a different table and recommendation. But this is basically the physical capabilities of a TPN. So we can have a 0 of any of these things and as much as the number that you see on the right-hand side. So this is the end of session 3 of the TPN lecture, and we'll pick up in session 4 next.